Truth Be Told podcast. My name is Erica and this is Brandy.
Hey, what's up, everybody?
If you're joining us for the first time, our podcast is focused on providing the underserved and underprivileged communities, particularly communities of color, with the information and tools to help improve their dental health care experience.
Mhm.
So today's episode is about types of dental x-rays, which, like Brandy, you said, it's somewhat part of it, your restorative care, because of course everything you get done, you have to get x-rays done, right?
Yeah, because
Okay.
they're definitely needed for your treatment.
Yes.
Yes.
So 5 types of dental x-rays. So I do not care for them. I'm not sure if anyone else does. I'm speaking for myself, but they're not fun for me. But
Mhm.
they're needed. They're necessary. We'll go to number 1. Bite
Mhm.
wing x-ray. Bite wing. So I feel like we're biting down on all of them, but explain a bite wing for us, Brandy.
Yes, so you are biting down on all of them, and the device that you're biting down on is called an XCP. And the bite wings are done on the side of the mouth, and in the image, you capture the top arch and the bottom arch. And the reason why this x ray is important is because we can see in between the teeth and at the gum line to check for cavities. So, this one is really important to also check the margin of permanent crowns when they're cemented to make sure they are placed properly. So, this one you will definitely get at least once a year.
Okay. That's very important. Checking those cavities, see what's going on down in there.
Mhm.
Okay, so moving on to the second one. It's correct me if I'm wrong, periapical. Tackle.
That's the periapical.
And I should have known it doesn't say pickle. It's not PICKLEY. It's PICAL at the end, but
Mhm.
Okay, so explain that.
So if you break down the word peri means around,
Uh-huh.
and apical is referring to the apex or the root of the tooth. So you
Okay.
want to see around the root. So this picture is taken, I tell patients it's an up close picture, but really it just shows the entire tooth. So from crown to the tip of the root. And so it'll capture a row of your teeth, but only in one arch. So either the upper arch or the lower arch, wherever you're having an issue. And we usually take this when patients are having a particular issue. If there's pain, if we suspect that there's damage to the tip of the root of the tooth, if there's issue with the jawbone, if there's infection, um, we'll take this picture. If somebody fractured a tooth, we'll take this picture so that we can see. And I will mention that a lot of offices do what's called a full mouth series or an FMX that is comprised of 18 films. 4 of them are bite wings, and the rest are all these periapical x rays. And I'm going to put little pictures in so you guys can see the difference of them. If you're a new patient, you may get those 18 films. And then have bite wings like every year or 6 months to a year just to check on cavities. But that's the difference in those two. One takes a whole snapshot of the entire tooth, the other one takes a snapshot of the top and bottom arch in between the teeth.
All right, folks, periapical, not periapical. Okay, the next one's a tongue twister too. Occlusal? Occlusal?
Yes,
Is that right?
close.
I said that right?
Occlusal.
Occlusal? Okay.
Yeah. Mm-hmm.
Yes. I used to be good with spelling and like spelling bees, I guess, but all right, tell us what this is.
So this x-ray is typically taken on children because you want to see where the adult teeth are in relation to the baby teeth. So usually we take one on the top arch and one on the bottom arch, and they're on the front teeth. So bottom front teeth and top front teeth. For this picture, you do not need to have an XCP, which is that device that you bite down on. You are either just biting down on the film itself, which we don't really use film anymore, or the sensor. You're just going to kind of rest your teeth on it gently, and then we take a picture. So this one is fairly comfortable.
That's not
It's
fair.
a comfortable one. Yeah, because they usually like to take this like to see, tooth development. Also, if there's an issue with the floor of the mouth or the roof of the mouth, they like to take this picture. It can also be used to be diagnosed cleft palate, or like if there's any cysts or abscesses or growths there in the roof of the mouth or the floor of the mouth. This x-ray will be used for those things.
Okay. Next will be panoramic x-ray.
Mhm.
So
So the pan is probably the easier x-ray to take
is that
for
what you
most
guys call
people.
it, the pan?
Yes, the Panorex or the panoramic x-ray or the pan. It's you stand up, and I don't know if you remember, you stand in the machine and the machine rotates around your head, and it takes a 2D image of course, a 3D image, but it gets all of your teeth in one shot.
Okay.
And this is basically for we take one because we like to see the sinuses, the nerves that run along the wisdom teeth, the wisdom teeth. So if the wisdom teeth are covered in tissue and bone, you'll be able to see them in this picture. So your orthodontist will also take this too. And I'm trying to think what else they would use it for. So like, yeah, when you're getting braces in preparation for wisdom teeth removal, any complications, jaw tumor, cyst, if you have any sinus issues, you'll be able to see it in this x-ray here. So
Okay.
and it's a pretty, like I said, you don't have to really put anything in. You have to just bite your teeth on a little prop just so they stay a little apart for the picture. But other than that, it's a simple picture to take.
All right. And last but not least, cephalometric.
You
I got it
got
right.
it. The
Cephalometric.
cephalometric.
Okay.
Yes.
Projection.
So
Cephalometric projection.
yeah, so we just call it Ceph. If somebody needs a Ceph, you get your Ceph. Get your Ceph on. Actually, we don't take this picture often. It's usually the orthodontist usually takes this picture.
Okay.
And it's a side view of your entire head and neck so that they can see how your teeth occlude or come together. So sometimes they'll take this for like not just braces, but like if you have sleep apnea, just to see the way your teeth and jaw align with each other. And then the neck, like I said, is in the frame too. Or if there's any issues with the throat, any structures in the throat or anything like that. But typically it's I'm trying to think. They also use it for like cancer, like if you have certain types of head and neck cancer to look at this. But in your regular dental setting, it'll typically be used for braces for your orthodontist. So like if you're coming for checkups and cleanings, we're not taking this picture.
Okay.
Yeah, we're not going to take this picture.
All right. So who would have ever thought? They never tell you. They just say, I'm taking x-rays, open your mouth. They take it out. They come back. They move the thing, the circle thing, the x-ray thing. Come back.
That's the cone beam.
Is that what it's called?
So,
And,
you know what I wanted to say, Erica? So sometimes patients will come in and they will think that because they had that panoramic x-ray or the Panorex, that they've had a full mouth series because it takes a picture of your full mouth. But that is not the case. The full mouth series, the FMX that I was talking about, is 18 single films. So different from one single film that takes a picture of your whole mouth. So a lot of times insurance companies will not pay for both. For whatever reason, they're two different things, but they won't pay for both. So you have to check with your insurance. A lot of times your dentist office will know that if they know your insurance and have a breakdown. But it's good for you to know too, because you don't want to get stuck getting a bill because you had an FMX, but you had a pan and they don't cover both. So I just keep that in mind. Those are two different things I wanted to mention that.
Okay. All right. So, folks, that's everything in regards to x-rays. If you have any additional questions, you can always write us on our website and Brady will take care of that. Not we, because I can't answer those questions for you. But shoot her an email through the website
Yeah.
And as always, check out the website. It has all the links to all of our socials. And also check out the Instagram as well. And Brandy, what else do you have to put in?
Well, if you guys have any idea for content that you want discussed, just let us know. Tooth Be Told podcast at gmail.com. You can email us there. You can also leave
Excuse me.
comments in YouTube or Instagram because we're on those mostly. Yeah, and just let us know.
Yes. And thanks again for joining us. Check you out next
Yes.
time.
All right. Take care, guys.
All right. Bye.
Bye.